welcome once again to another edition of the Modern Farming Podcast, brought to you by the Green Gene Foundation, where we are cultivating agricultural excellence every day.
We're your hosts, Chris and Tara, and together we're growing in knowledge about the world that feeds us.
Thanks, Tara. And today we have a very interesting guest, the director of the Vincent House Pasco. Her name is Elizabeth Statzer. She's here to talk a little bit about her program and the program she oversees there at Vincent House. So welcome, Elizabeth. Tell us a little bit about yourself.
Thank you for having me. Thank you for the opportunity. We love the Green Gene Foundation and all the good work that you all do. I've been in mental health for over 25 years. Mental health, social services. My background is psychology and criminology. And I used to work at the state substance abuse and mental health office, where part of our job was to oversee the system of care and to fund programs, mental health and substance abuse treatment services for folks that don't have insurance. And back in those days, Vincent House was one of our contracts. DCF, substance abuse and mental health funding, is a large funding stream for Vincent House. Vincent House at that time only had one location. They were in Pinellas Park. And I've known the founders of Vincent House for all these years. That was probably 16, 17 years ago. It's been a really full circle moment for me to find myself here as the director of Vincent House Pasco.
It's a wonderful program. I've been there and visited. Tell me about the clubhouse aspect of it and how it's different from other institutions that are available for anyone out there that needs help.
So Clubhouse is the model. You have all kinds of different mental health models. Clubhouse is the model. Clubhouse is considered an evidence-based practice. Clubhouse started in the late 1940s up in New York. There were a bunch of folks who'd been discharged from psychiatric facilities. And they started to hang out, and they started to make lunch, and they started to write a newsletter. And then they got a brownstone, and they became a place called Fountain House. Fountain House was the very first clubhouse. There are now almost 400 clubhouses around the world. So you have Fountain House, and you have Hope Clubhouse, and you have Gateway Center. You have all these clubhouses around the world. We all follow the same 37 accreditation standards. So it's measurable, it's effective. We can replicate it in other areas. Vincent House started when our founders, Elliot and Diane Steele, they had entirely separate careers. He was a hospital administrator and chef. She was a veterinarian. And their daughter was diagnosed with mental illness when she was in college. They did a lot of research, they did a lot of advocacy, and they found the Clubhouse Model, which really didn't exist in Florida at the time. And they left their careers. He left the hospital system, she left the veterinary practice, and they opened Vincent House in a small little storefront in Pinellas Park with an ice chest for a fridge and a hot plate for a burner. We've expanded. We're still in Pinellas Park. We actually just celebrated our 23rd anniversary. We have a second location in Spring Hill. And we opened Vincent House Pasco. Our ribbon cutting was September of 2020. So we've been here for a little over 5 years in Hudson, Florida. We sit on 10 total acres of land. Pasco County has been an amazing partner to us. We serve individuals 18 and up that are living with a history of mental illness. We are not, however, a clinical program. We don't do groups. We don't do therapy. We don't do medication. That's all very important. We don't replace that. Most of our people get those services at our community partners and clinical providers. We do something different. Everybody needs to be needed. Everybody needs a purpose. Everybody needs a reason to get out of bed in the morning. And mental illness can be a really isolating set of illnesses. So Clubhouse, we call it our work order day. We are a voluntary program. Members, we call our folks members, not patients or clients. Members come in as much or as little as they want. Membership is not only voluntary, it's without time limits. So it's not a program that people have to graduate from. We're not fighting insurance for a last covered day. People don't make appointments to come in. They come in whenever they want to choose to utilize the clubhouse however they want. We're open Monday through Friday from 8 to 4. We do a daily meeting every morning at 9, and then we break into our work units and sign up for jobs. We serve lunch every day at 11:45, and then we break into our work units and sign up for afternoon jobs. So it's very structured, but there's a lot of choice in how members utilize the clubhouse. We don't have a custodial crew that comes in. We maintain the building, members and staff side by side. We don't have a catering crew that comes in. We make lunch every day, members and staff side by side. We have a garden. One of my staff is a certified master gardener. Those are also jobs that people sign up for, and we maintain the garden, members and staff side by side. That's where the relationship is developed. The relationship is a little bit different than when you go see your therapist because we're not doing that clinical work. Anybody who's ever been to therapy can tell you therapy can be hard work. You're talking about coping skills and diagnosis and all of that stuff, that hard work that you do in therapy. And because we don't do that, the boundaries here are a little bit different. People make friends here. You shouldn't be making friends when you go to your therapist or your psychiatrist. But because we're not doing that clinical work, people really find community here in Clubhouse and find that purpose. We have 5 staff, including myself. We'll have 5 staff if there's no one here. We'll have 5 staff if there are 100 people here. Because when I look at my members and I say, I need your help with something, I truly need their help with something. It's not made up work. It is purposeful work that's necessary in order to get the work order day done, which is also what makes us different from a drop-in center or day treatment or an adult daycare center. We don't sit around and color all day. We have work that we need to do. The work of Clubhouse is designed to be job preparedness training, not job specific skill training, but I can't teach somebody how to work at Starbucks. But if somebody wants a job at Starbucks, sign up to work in our cafe. In our cafe, we have a retail point of sale system. That's where we order coffee, drinks, snacks. That's where we order lunch. For any entree that needs to be prepared in the kitchen, we always have an entree of the day for $3. A ticket will ring back in the kitchen so we know how many entrees to make, how many salads to make, how many sandwiches to make. So if you wanted that kind of retail food service kind of job, working a register, sign up to work the cafe, practice those job skills. Everybody here is living with a history of mental illness, so everybody here is going to be kind and patient and understanding, which might not be the experience that you get at Starbucks, but it's good practice. Building up our endurance to be here for 2, 4, 6, 8 hours at a time. Being around other people is a skill that some of our members need to work on, right? And so Clubhouse provides all of that organically as we work through our work order day.
So how did you discover, or did Vincent House discover you, and how did you get involved in this?
So I'd been familiar with Vincent House from my days when we funded Vincent House. I've known Elliot and Diane for many years now, and they are semi-retired. And they'd broken ground here at Vincent House Pasco. And I'd been involved with Vincent House here and there over the years, attended fundraisers. I was a speaker at a fundraiser one year just because I loved the model so much. They called me up from Colorado. They're semi-retired in Colorado and then half the year in Florida. And they said, Elizabeth, you're working out in the community. I was doing business development for a hospital company at the time. And they said, we've hired an outreach coordinator. Will you take him out in the community and introduce him to people? And I said, of course, Vincent House is my favorite. And so I took him out in the community and I took him to different meetings and I introduced him to different people. And after about 6 months, he asked me, why don't you work for Vincent House? And I was like, yeah, sure. He's like, no, really, we're looking for a Pasco director. Can I say something to Elliot and Diane? And I said, yeah. And Elliot and Diane called me that night and they were like, are you serious? I thought, well, are you serious? I wasn't necessarily looking to leave my job, but I started in March of 2020, a week after we had shut our doors due to COVID. So my first 6 months was completely virtual, but we were under construction here in Pasco at the time. So when we had our ribbon cutting in September of 2020, we moved into the building and we've been here ever since.
So I want to know more about how somebody could use this resource, the Vincent House. How do they sign up, or what does that entail for them to become a member at your clubhouse?
So our criteria is 18 and up with a history of mental illness. We here at Pasco have a very young population. That wasn't something we set out intentionally to do. I think just because of a lot of young families that have moved to the area, we tend to have a younger population. So I get a lot of moms, dads, brothers, neighbors that really want their loved one to be a part of Vincent House. And I'm not sure it's always voluntary on their loved one's side. So 18 and up, history of mental illness, and then able and willing to participate on a voluntary basis. We ask potential members to come in for a tour first because we are so different than traditional mental health programs. And we do require some clinical documentation. We don't have licensed staff here. It's not what we do, but we do need documentation of a history of mental illness and a psych eval. So we give that to them at the end of the tour. Accountability, we want them to be motivated to get that paperwork completed by their clinician. And then when the clinician sends that information back to them, we call them up and say, when do you want to start? People do not need to have insurance to come to us. We don't bill health insurance. We're funded primarily from the state and from the county, from private grants and fundraisers. We ask members to pay a membership fee. It is not mandatory. It's less of a revenue stream for us and more for some buy-in. Right. I have a lady who brings me $1 a month, and she's very proud of that $1 a month that she contributes to her clubhouse.
It sounds like you're really building a program where people feel wanted and needed, and a safe place for them to work through whatever their case happens to be. How do you work up what you offer, what the folks do there at Clubhouse?
The work that needs to be done. One of the things that I've learned in the past almost 6 years, people with mental illness know when it's not genuine, meaningful work, when it's just token work, getting something done. So we figure it out together. And members are involved in all aspects of Clubhouse work. It includes cleaning bathrooms. You're just as likely to see a staff person cleaning a bathroom as you are a member, or doing it together. That also includes serving on our board of directors. Members truly are involved in all aspects. We have different bottom line responsibilities, but we figure it out together. We make decisions in Clubhouse based on consensus, which means we don't vote. We continue to talk things through until we come to decisions that everybody can live with. So when we first opened, we created our job boards all together. What needs to be done? What needs to be cleaned? How do we do the daily newsletter? Lunch has to be made every day. So we've really developed our job boards together over the years, and members choose not only which work unit they want to work in, but what jobs they want to do in the work unit. As I mentioned, the work of Clubhouse is designed to be job preparedness training. So we really want them to be skills that people can transfer to the workplace, right? People will use their volunteer work at Vincent House on a resume or a cover letter. We use Canva for our newsletter. That's a very easily transferable job skill. Our culinary members, we can train them in Serve Safe. They can put that on a resume before they ever apply for a job in food service. So employment is the other big piece of what Clubhouse does. A lot of people with mental illness have been told that they can't work, and we prove that wrong every day. So not just through the work at Clubhouse, but we focus a lot on employment. We're a supported employment provider and a vendor through vocational rehabilitation. Sometimes it's not about getting a job. Sometimes it's about keeping a job. So we help with resumes, cover letters, mock interviews. We can go on an interview with a person, whatever level of support they need, not only to get that job, but to keep that job. And then vocational rehabilitation is a revenue stream for us when people hit certain benchmarks. The other big program that we talk about that is a Clubhouse thing and is unique to Clubhouse, every Clubhouse around the world does it, is called transitional employment. And our transitional employment, we have job placements that we create with a community employer. It could be anybody. We look for entry-level work because it needs to be a job that anybody can do. We have 18-year-olds, we have 75-year-olds. We have people who have doctorate degrees. We have people who never finished high school. We have people who teach yoga, and we have people that are in wheelchairs. Mental illness is the thing they all have in common. But we look for entry-level work, so it needs to be a job that anybody can do. We look for 12 to 20 hours a week because if a person is on disability, we don't want to put their benefits at risk. We ask the employer to trust us to fit a member into those transitional employment jobs without an interview. An interview can be scary, especially if you have gaps in employment history. And we know our folks. We're making lunch together every day. We're cleaning bathrooms together every day. I talk a lot about bathrooms. And so no interview. We go with the member for the first day, 2 days, however long it takes to train that member. We train them. We take that off the shoulders of the employer. And then we gradually back away until the member's going to that job by themselves. They're paid by the employer at the employer's place of work. So it's real work experience that they can put on a resume. It's transitional in nature, though. It's for 6 to 9 months. At the end of that 6 months, we're going to fit somebody else to that job. And then in 6 months, we're going to fit somebody else to that job, and so on and so on. During that 6 months, if the member has a crisis or a doctor's appointment or has to call out sick, we cover the shift. So we're asking the employer to not have an interview, but we're guaranteeing 100% coverage, which makes it a really safe way for our members to try out employment without having to commit to a forever career. A lot of times after a TE placement is over, it's really about the confidence. Hey, I can do this. I can work. I want to go get my own job. I want to go back to school. So we have some great community partners here in Pasco County. The Pasco County Housing Authority is amazing to us, as is with Lakootsee River Electric Co-op. And then we also have a job at Amerikey Locksmith. It's a marketing job. We go out and try to get them business. I was with a member on Monday, driving her around, going into different businesses, talking about Amerikey. 2 days later, they got a job. They got a job from the outreach that she did. So it's necessary, real work, but it's, like I said, a safe way for our members to try out what employment feels like. We just added a greenhouse, and we just added a weather station. It's going to be pretty amazing, and it's great work experience, right? It's great work. I had a member who was applying for a job at like a Lowe's garden center, and he said, "Can I put that I work in the garden with a master gardener on my resume?" Absolutely. The garden is almost finished being built. We're going to be planting the new garden soon. We've had eggplant and carrots and lettuce and kale, and we had a lemon tree and a guava tree, and I'd never seen broccoli or squash growing before. And so it's so cool. I mean, as you all know, it's so cool to be able to see that process and then to harvest and then to make lunch with the fruits and vegetables that we've been growing for months. The garden really drives the menu. I will say there are only so many things that you can do with eggplant.
Interesting. And not only does it give somebody a job skill background, what Green Jeans is all about, that knowledge of growing, right? Now you've also learned something for yourself that anyone could grow a garden at their house. And you've got to be exposed to that. You've got to be taught that. Nobody just starts it, right? Everybody has to have the info. So that's great.
And it starts a nutrition conversation, healthy eating and fruits and vegetables and, low sugar and diabetes. Like it drives a nutrition conversation. It's also a really great way. Some of our members do really well in enclosed spaces. Sometimes to be able to go outside and to work in the garden is very therapeutic for some of our people. So to have that extra work unit that offers just a different environment is really helpful for a lot of our members.
Can you tell me about some of the barriers that you run into with Vincent House?
Probably our biggest barrier, and I would encourage anybody, if you ever want to come out for a tour, to see the garden, to see the building, to learn more about what we do. We love giving tours. It really, I can talk about Clubhouse all day long. It's different when you see it and you feel it and you meet our people. I see Tara's nodding her head. We are in a very rural location here, which has some advantages. Our first accreditation visit, the director who came out and was here, she's like, "Oh my gosh, your people stay all day." Well, there's nowhere for them to go. We're 2 miles from the nearest gas station, which does make transportation a really significant barrier for us. We were on a bus route, but through no fault, I'm not blaming Pasco County at all. They did a really comprehensive evaluation of the bus system, and due to the low ridership, the bus route was eliminated. So transportation is a constant struggle for us. We have 2 vehicles, so we can provide a certain amount of transportation. We don't have a driver. So we do a fair amount of transportation. It is not unusual for there to be a day where between family or insurance rides, sometimes insurance will cover transportation here. They'll consider us a mental health service and thus cover transportation. Between us, friends, whatever combination of transportation gets people here, it is not uncommon for every member here to not have gotten here on their own.
Yeah.
There are some things we always need, not just in a barrier kind of way, but we always need employers, whether it's a potential transitional employment partner or whether it's just a good, solid, supported employment provider. We always need employers. We always need board members. Van Gogh's Palette is our official board of directors. They serve all 3 of the Vincent House locations. Did you get that? Vincent House, Vincent Van Gogh, he lived with mental illness and still created beautiful works of art. So Van Gogh's Palette serves all 3 of the Vincent houses. Here in Pasco, we have a Pasco advisory board focusing on the needs of this location specifically. So in addition to the constant financial needs, we're always looking for employers and we're always looking for board participation.
Wow, because it is pretty amazing. And I didn't realize you were a nationwide operation, so to speak.
Last year, every 2 years, Clubhouse International, our accreditation body, does a world seminar. It was supposed to be in Canada last year, but there was a trade dispute and they couldn't get a location. And so they asked Florida. There are about 20 clubhouses in Florida at this point. They asked Florida to host. Our Florida Clubhouse Coalition hosted, and it was in St. Pete Beach, which was kind of anticlimactic for us. But I think there were 16 different countries represented. I'm at the new clubhouse in Argentina that just opened a few years ago. And we all follow the same 37 accreditation standards. Membership is always voluntary and without time limits. Every clubhouse does transitional employment. So I truly could walk into that clubhouse in Argentina or in China or in Norway, and I wouldn't speak the language, but I would still understand what was going on and why. Not everybody might have 10 acres of land and a garden with 50 beds in it, but the model is the same. The people are the same.
I just wanted to know about welcoming the public in general to come into your institution, just to see more about what you do and how you do it.
It's a fine balance. Like I said, we will always give tours to community partners so they can learn about Vincent House and the model. I often get a question about volunteer opportunities, and that's kind of a fine needle to thread too, because the work of Clubhouse, the work order day of Clubhouse, that is volunteer work for our members. That's their purpose throughout the day. But every once in a while, when we have large events, for instance, we here at Vincent House, we build in time after hours and on weekends for socials. That's not only to stay connected as a community, but also for our members who are working that might not be able to be present in Clubhouse to still have a connection to their community and their friends. Membership is without time limits. So we build in time after hours on weekends. So we have a volunteer yoga instructor. We have different kind of events that people volunteer for. We also celebrate holidays on the actual holiday. Most mental health programs are closed. Sometimes that's when folks need us the most. So we're here Thanksgiving Day, Christmas Day, New Year's Day. We had about 70 people here for Thanksgiving this year. So when they're large events, we can sometimes use some volunteer opportunities. And then with the garden, as we've been rebuilding the garden, that's been a lot of work. And so we've had 2 garden days on the weekends. Green Jeans has come out and helped. We had volunteers from a local Rotary club come out and help. So there are other volunteer opportunities, but not, it's like I said, it's a tricky balance with having members have purpose during the work order day and having volunteers support us.
I think that getting the word out and letting more people know about what's available there, definitely why we're doing this. We definitely appreciate everything that you do and see the progress in the people there, and it's a happy environment.
And it's absolutely the people. And I think, Tara, you can feel it. I've been an advocate for people that are living with mental illness my whole career. That's always the population that I've wanted to work with, that I'm honored to work with. And I said it before, but when you go to your doctor's office, you don't make friends at your doctor's office. It's a doctor's office. A lot of our people have been through crisis units, detox units, residential programs. They're necessary. They're necessary to keep people safe sometimes, but they're not often joyful.
Right.
And there's a certain joy when you walk into Clubhouse because we're not doing that hard work of treatment. We're doing something else. So we don't replace it, but in conjunction with those clinical services, that's when our members thrive. That's when we see decreased hospitalizations. That's when we see increased length of time between hospitalizations. That's when we see loneliness. That's when we see a decrease in loneliness and a feeling of connectedness. That's the piece that Clubhouse provides.
Thank you, Vincent.
So that's all we've got for you today from Vincent House. And Miss Elizabeth, thank you for joining us.
And thanks for listening, and be sure to follow us and share and join us again as we grow in the knowledge about the world that feeds us.